Hey guys, how are you and welcome to my YouTube channel. I'm really glad and excited to have you on board. My name is Dr. Victoria. I am doing a series on contraception, and in my last video I did a topic comprehensive on emergency contraceptive pills, and I showed you the different types of brands that are there in the market. So if you haven't watched that video, please remember to do so. Now today I want to talk about the intrauterine contraceptive device, or rather the coil. This is how it looks like when it's in a packet. This is a type of long-term reversible contraceptive device inserted into your uterus. Now we have two types. We have this which I have here, what we refer to as the what we refer to as the copper T intrauterine device. And if you just read the packet, this is the copper T 380A stroke TCU 380E intrauterine device. It's meant to be used for up to 10 years and can be removed anytime, but you're not supposed to have it for more than 10 years. It stops becoming efficacious. And then we have another type that I don't have here, and also not very much common in our Kenyan market, what we refer to as Mirena. It's the same as this, but now the mode of action is different. That one is hormonal, this one is non-hormonal. Now, besides the use of this contraceptive device in long-term measures, it can also be used as an emergency form of contraception for those who've had sexual intercourse within 5 days of unprotected sex. Now, why is this contraception very good? Number one, it's affordable. In the Kenyan market, from where I am, I have done a survey, and this will cost you like around 600 shillings if you go to public facilities. And I'm not sure about the prices in the private sector. Then the other thing is that this copper type is non-hormonal. So for those of you who are struggling with different diseases, chronic diseases, which could be worsened or whose progression could be interfered with by use of a hormonal form of contraception, then this is the best to use. The other thing is that you can use it for a very long time, for up to 10 years. Its failure rate is very low, about 0.08% for this one, and about 0.02% for the hormonal one. Now, how does this IUCD work? So I'll have to, let me show it to you first, guys, and then we can talk about how it works and which kind of people cannot use these. Once it's inserted, what are the side effects, any contraindications, what is expected. So I am opening it. This is for the purpose of us learning, okay? But normally in the clinic, it's a sterile procedure, so a nurse will not, or a doctor will not just open it like this using his or her hands the way I'm doing. So I have exposed it for you guys, and so I want to show you guys how it is used and everything. So this is it. So the main aim why I'm removing this is just to show you how it looks like. So this here is the coil that's going to be inserted. So this is the coil. So around here, the shiny things, that's the copper, and that's the copper. So how this is inserted is that when you go to the doctor, you are going to lie in a position comparable to that person who wants to give birth. And then they're going to use something which is called a speculum to open your vagina well, so that the health professional can see the cervix. They'll use something called a tenaculum to hold your cervix well. And then using a skill, this is gonna be inserted. It won't be inserted this way. I've already opened it because I want us to learn. So when this is going to be inserted, And then once it's inside your uterus, about 3 to 4 centimeters of this string is going to be cut. So this is how it is. It's not big, guys. The width of this thing is like 28 to 30 millimeters. And you can see it's very small. So don't be scared. So this is our copper intrauterine device. Now, how is this thing going to work? So the first thing is that this copper causes some reaction in your womb, and this is going to interfere with the motility of your sperm, of the sperms of your partner. Besides interfering with motility, it will interfere with the viability. So motility in such a way that it will prevent the sperms from reaching the egg. And then viability in such a way that it will interfere with the aliveness and the ability of the sperm to actually fertilize the egg, because it won't be viable. Now, which kind of people cannot use this IUCD? So number one, we have people who have an active sexually transmitted infection. This is not going to be used. Number two, we have people who unfortunately have malignancies, let's say cancer of the cervix, of the uterus. Then this is not going to be a good option. We have those who have gone through abortions, and in this case it's been a septic abortion, meaning an infection has been there, and this patient for one or another reason has had to take a full course of antibiotics. Then these may not be the preferable. We also have people who have uterine anomalies, which in times can interfere or rather distort the shape of the uterus. This is not going to really work. And then you can use this IUCD within 10 minutes after birth. If not so, then let's say 4 to 6 weeks after giving birth, this is a viable option. So once this IUCD is inserted, during insertion, some of the complications that might come about, though very, very rare, is number one, you could have perforation of your uterus. And this could mostly be done by the instruments that are used. There's an instrument which we call the uterine sound. It's metal-like and it's long. It's used to measure the size of your uterus for them to know if the size of the IUCD to use. So that at times, if vigorously used by the health professional, can cause uterine perforation. And then the other thing is that especially within the first month, there is a high risk of the IUCD coming out. That is another thing. Then there's failure. I've said it's 0.08% effective, meaning there is still a chance, though very small, but there is still a chance that this could fail and you could actually become pregnant. And then the other thing with this is, for some people, especially for the copper one, once inserted, they tend to experience very heavy menses. At the end of every month, they get very heavy menses, but not so. There are those whom this copper IUCD does not at all interfere with their monthly menses. So what are some of the things that you expect after this has been inserted? This is a foreign body that's being introduced into your body. Of course, the body is going to react. So number one, you could experience some abdominal pains because this has been inserted. And then you could also have some discharge, like watery discharge as reported by other clients. But at the end of it all, it resolves. Once this has been inserted, it's very important that after 1 month, you go to your health facility for it to be checked. And then you can also be checked after 6 months. Then after that, you're good to go. But also as a person, you see these strings are just below your cervix. So you can be able to, the way you guys insert tampons and pessaries into your vagina, you can just be able to check and see if you can feel these strings. So if you don't feel these strings, then there's a likelihood that this thing has been displaced. Or sometimes you feel the string becoming longer. Maybe you just used to feel a tip of it, and now you're feeling it's longer than the way it was before. That could also be another indication that your IUCD has been displaced. So that is all I have for you today. I want to encourage you, for those who are in sexually active relationships, marriages, please, 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 this is going to save you a great deal. It's going to help you plan for your family the way you're supposed to. And that is all from me. If you have any questions or any comments, any additions, you're welcome to do so. And if you haven't subscribed to this channel, please, please do so. In our next series of conversation, we'll be talking about the combined oral contraceptive pills. I look forward to coming with them here. Thank you and God bless you. Bye-bye.